Today we're going to talk about patient satisfaction in the emergency department. We're going to start out by looking at what patient satisfaction is, how it's measured, the financial impacts of patient satisfaction, and then we're going to look at the current scores in this organization related to 3 specific areas of patient satisfaction. After we look at those scores, we're going to look at ways to improve those scores, looking at some new and innovative ways to do that. And then we're going to look at why we should improve the scores and what is significant about improving the scores. So let's go ahead and get started. So what is patient satisfaction in the emergency department? Plain and simple, patient satisfaction or patient experience has to do with the patient's perception of care that they received while they're in the emergency department. It is independent of quality, it is independent of patient outcomes, although those very well could be tied into this. But it really is just about how the patient thinks their care was. The surveys were set up by CMS, which is the Center for Medicare and Medicaid, and the main topics in the surveys have to do with communication, cleanliness of the facility, medication, including medications that were given and education around them, coordination of care, did the patient know what to do on discharge, and communication really is encompassed in all of this and has to do with how the physicians and the nurses spoke to the patient and how well the patient understood that. The questions are answered as always, sometimes, or never, so it's very important for staff to, every time they interact with a patient, be mindful of what these survey questions are. Patient satisfaction is measured by a paper survey that gets sent out to patients once they are discharged from the emergency department. There are 2 different versions of this. There's an admitted patient survey, which gets sent to patients who are admitted to the hospital, and there is an emergency department component of that survey. And then there's also a separate survey that is sent out to patients who are treated and released or just discharged from the emergency department. The surveys get sent out by a company called Press Ganey. They are an independent company, and what they do is they collect and collate data for us. They send us the data back, which is specific to our organization emergency departments. And then they also compare us nationwide with like-sized emergency departments. So what they look at is the top box, or the percent of people who answer always on questions, and then they rank how many people answer always to the nationwide emergency departments, and that gives us our rank. Our goal is to be in the 75th percentile, meaning that we are better or have higher scores than 75% of the other emergency departments in the country. The gold standard really is the 90th percentile. There are a couple different financial impacts to patient satisfaction scores. The first would be government reimbursements. We've been talking a lot about CMS, Centers for Medicare and Medicaid, who is the largest payer or reimburser to our organization. And what CMS does is they look at the Press Ganey scores, and if we're not at the proper threshold, they will penalize by 1% or 2% of those reimbursements, which, when we're looking at big business and we're talking about millions of dollars, a 1% penalty can have a huge financial impact on revenue. Another thing is that CMS has a public website, which is Hospital Compare, and they post the scores on there as well as other quality members. Any tech-savvy or even remotely tech-savvy person can get on there and look to see where the best quality is. And having low scores can definitely impact which emergency department patients will go to, which can result in a decrease in emergency department visits, which again is decrease in revenue. Also, the patient satisfaction scores are in line with the accountable care organization model, which again has to do with government reimbursements. Accrediting bodies also look at these scores. Again, Centers for Medicare and Medicaid, CMS, very interested in what the scores are for the organization. The Agency for Healthcare Research and Quality, AHRQ, also had a part in developing these surveys with CMS, so they too are looking for that quality factor here, and the Joint Commission looks at them as well. Here's a look at the current scores for 3 very specific questions from the Press-Ganey scores or patient satisfaction surveys. The first one is the likelihood of recommending the emergency department. Like I said before, the top box is the number of people or the percent of people who answered always to that question. So our top box response is 65%, which puts us in the 35th percentile, or states that we are better than 35% of the country, which means we are not better than 65% of the country. Nurses treating you with courtesy and respect, 80% of the people who responded answered that they always did, but again, this is only the 30th percentile, so it's really very relative to what's going on in the rest of the country. The other question that we're going to look at is, did the doctors treat you with courtesy and respect? Our top box response for that is 76%, and that is in the 15th percentile. And now we're going to take a look at ways we can improve on these areas. One of the most important things we can do to increase our patient satisfaction scores is to help set the expectations for the patient while they're in the emergency department. There's often a disconnect between what the patient feels should be happening and what the staff expectations are for the visit. I would recommend giving an educational handout in the triage area to each patient and/or caregiver that really outlines the flow of the emergency department, why they're waiting, what they're waiting for, and what they can expect next. This will also cover staff roles, who they're going to come in contact with and what the role of that person is, what they're doing there. Average turnaround times for things such as labs and radiology testing, and also some post-visit information to actually kind of start the discharge process from the very beginning of the visit. The second part to giving out a handout with the expectations would be to really encourage the staff to reference those educational handouts. And that way the patients know for sure this is really what we feel the expectations are for their visit in the emergency department. Additionally, we can use the screensavers, which we have computers located in almost every room of the emergency department, and change the message on those to really reflect the expectations of the patient visit instead of things that are more staff-oriented, like look-alike and sound-alike medications. For the question related to the nurses speaking to you with courtesy and respect, this really comes down to nursing education and reminding the nursing staff to treat patients like he or she is your only patient. This can be challenging whenever it's busy, but going into a room, shutting the door, sitting down whenever you're able, and really acknowledging and validating patient concerns. As a nurse leader, I often get the patient complaints, and many complaints center around this very thing. Patients feel like they're blown off, they feel like no one was listening, they feel like no one cared and that no one addressed their real issues while they were there. The other part of the education is that it really needs to be collaborative with not just nursing, learning about patient satisfaction, but also having the physicians involved in that and having very open, frank dialogue about patient satisfaction. Research has shown that in addition to everything we just talked about for the nurses, such as validating patient concerns and addressing the issues why the patient came to the emergency department, that the physician introducing himself or herself to the patient and making sure the patient knows the physician's name had a dramatic increase in patient satisfaction scores. And from the physician standpoint, not only education, but getting real-time feedback related to scores was very beneficial and showed correlation with scores going up. Next, we're going to look at why we want to improve our scores. In addition to the financial impacts that we talked about earlier, the bottom line is we are better than what our scores show. The patient satisfaction scores really are designed to reflect the atmosphere of the care department, and I do not feel that our current scores are an accurate reflection of the care that we provide. Making minor changes to the patient care routine, whether it be sitting down like we talked about earlier, making sure we're making eye contact, not focusing so much on the computer, can have huge impact in our percents of people answering always, which again will have the direct impact on our percentile. The risks for making these changes are really minimal. We're already not meeting the mark where we should be. So making some minor changes, even though it can create some stress to make changes in your normal routine, really are going to be outweighed by the benefits of better collaboration, better care for the patient, and the patient feeling like they are getting better care and that they are more involved in their health care. Measuring success for this initiative is relatively simple. Press Ganey sends us the data every month. It is published on the organization's intranet. It is also physically published in the department. So it's very easy for the staff to see where we're at and where we're going. Within a year, I would like to see us get to the 75th percentile in all three of these areas. If we look at this, likelihood of recommending the emergency department, we need to increase 10% from 63% of the people saying always to 73. Nurses treating you with courtesy and respect, we only need to go up by 8% in that area. And for the physicians, again, it's 10% between the 15th percentile all the way up to the 75th percentile. This is, within a year, very achievable, very attainable, and I know that we can do this. As the picture says, working together to achieve these goals will bring us joy, happiness, and ultimately satisfaction, not only from our patient's point of view, but from the staff point of view as well.